Question 1. An SPD technician is inspecting a newly purchased ultrasonic cleaner for the decontamination area. Before this equipment can be legally sold and utilized in the healthcare facility, which government agency exercises regulatory authority over its safety and effectiveness as a medical device? A. Occupational Safety and Health Administration, OSHA. B. Environmental Protection Agency, EPA. C. U.S. Food and Drug Administration, FDA. D. Association of Perioperative Registered Nurses, AORN. Correct answer C. Knowledge point explanation. Core rationale. The FDA is the premier federal regulatory agency responsible for ensuring that all medical devices, including equipment like ultrasonic cleaners and sterilizers used in the SPD, are safe and effective for patient use. Trap analysis. Option A is incorrect because OSHA specifically regulates the occupational safety of the technician, like requiring waterproof gowns, not the commercial medical device itself. Option B is incorrect because the EPA regulates environmental issues and surface disinfectants, not the operational safety of medical processing equipment. Option D is incorrect because AORN is a professional organization that provides voluntary surgical guidelines, lacking the legal governmental authority to regulate device manufacturing. Concept extension. The FDA categorizes an ultrasonic cleaner as a Class 1 medical device, which generally subjects it to general controls due to its low patient risk profile. Question 2. Which federal agency develops and strictly enforces chemical regulations specifically targeting environmental impact, including the oversight of hospital-grade surface disinfectants and hazardous sterilant emissions? A. Occupational Safety and Health Administration, OSHA. B. U.S. Food and Drug Administration, FDA. C. Environmental Protection Agency, EPA. D. Association for the Advancement of Medical Instrumentation, AAMI. Correct answer C. Knowledge point explanation. Core rationale. The EPA regulates chemicals that directly affect the environment. Because hospital surface disinfectants are legally classified as pesticides under federal law, the EPA heavily regulates their manufacturing, registration, and safe environmental use. Trap analysis. Option A is incorrect because OSHA strictly monitors the worker's exposure to hazardous chemicals, like setting permissible exposure limits, rather than regulating the environmental impact of the chemical itself. Option B is incorrect because the FDA regulates chemical formulations classified as drugs, food additives, or high-level disinfectants for critical instruments, not general environmental surface cleaners. Option D is incorrect because AAMI writes consensus standards for processing methodologies, not federal chemical environmental laws. Concept extension. The EPA also heavily regulates the atmospheric emission of ethylene oxide, EO, gas from sterilization facilities under the Clean Air Act to prevent toxic air pollution. Question 3. A decontamination technician is diluting a concentrated quaternary ammonium compound to mop the floors. The technician must carefully read the container to verify the exact dilution ratio and wet contact time. Which agency legally imposes these highly detailed, strict labeling requirements on the manufacturers of surface disinfectants? A. Occupational Safety and Health Administration, OSHA. B. U.S. Food and Drug Administration, FDA. C. Environmental Protection Agency, EPA. D. Centers for Disease Control and Prevention, CDC. Correct answer C. Knowledge point explanation. Core rationale. Because the EPA legally categorizes environmental surface disinfectants as pesticides, it mandates that manufacturers provide comprehensive labels featuring an official registration number, explicit kill claims, dilution instructions, and vital safety warnings. Trap analysis. Option A is incorrect because OSHA mandates that employers provide safety data sheets, SDS, for worker hazard communication, but it does not dictate the specific pesticide efficacy labeling required on the physical chemical bottle. Option B is incorrect because the FDA regulates the labeling of high-level disinfectants, HLDs, used on medical devices, not the floor sanitizers used for environmental surfaces. Option D is incorrect because the CDC provides voluntary epidemiological guidelines for infection control, lacking the regulatory power to force manufacturers to adopt specific chemical labels. Concept extension. Using an EPA-registered disinfectant contrary to its explicit label instructions is a prosecutable violation of federal law. Question 4. Which primary organization acts as the preeminent source for developing voluntary, consensus-based standards that comprehensively define the basic safety, quality parameters, and best practices for processing medical equipment in healthcare facilities? A. Occupational Safety and Health Administration, OSHA. B. U.S. Food and Drug Administration, FDA. C. Association for the Advancement of Medical Instrumentation, AAMI. D. Association of Perioperative Registered Nurses, AORN. Correct answer C. Knowledge point explanation. Core Rationale, AAMI is an authoritative non-profit organization comprised of industry professionals who collaborate to write the definitive, consensus-based standards for sterilization and medical device processing. Their published documents are universally recognized as the foundation of SPD best practices. Trap analysis. Option A is incorrect because OSHA strictly focuses on mandatory worker safety regulations rather than drafting detailed best practices for equipment sterilization. Option B is incorrect because the FDA regulates the commercial release of equipment but does not author the step-by-step consensus practice standards for hospital technicians. Option D is incorrect because AORN focuses its recommended practices specifically on the clinical nursing environment within the operating room, not the core engineering standards for medical processing equipment. Concept extension. ANSI/AAMI ST79 is widely considered the ultimate Bible of steam sterilization parameters and quality assurance testing within the United States. Question 5. A hospital is considering purchasing a new dynamic air removal steam sterilizer. Before this moderate-risk equipment can be legally sold to the facility, the manufacturer must submit a 510(k) pre-market notification. Which federal agency develops and strictly enforces the regulations governing these Class II medical devices? A. U.S. Food and Drug Administration, FDA. B. Environmental Protection Agency, EPA. C. Occupational Safety and Health Administration, OSHA. D. The Joint Commission, TJC. Correct answer A. Knowledge point explanation. Core rationale. The FDA is legally entrusted with classifying all medical devices based on their inherent risk profile. Sterilizers, biological indicators, and most surgical instruments are categorized as Class II devices, meaning the FDA enforces special controls and evaluates their substantial equivalence before market approval. Trap analysis. Option B is incorrect because the EPA focuses solely on environmental protection laws, possessing zero regulatory jurisdiction over the clinical classification and commercial release of medical steam sterilizers. Option C is incorrect because OSHA only ensures the sterilizer operates safely without causing burn or crush injuries to the worker, but does not grant the commercial Class II market clearance. Option D is incorrect because TJC evaluates how the hospital uses the sterilizer during an accreditation survey, but lacks the federal authority to regulate the manufacturer's device classification. Concept extension. Class III devices, like implantable pacemakers, present the highest risk and demand a much more rigorous FDA pre-market approval, PMA, process involving extensive clinical data. Question 6. An experienced technician is preparing a shipment of critical, life-sustaining cardiovascular implants, including heart valves and pacemakers. Because these devices are implanted directly into the human body and represent the highest risk to patient safety, under which strict classification do these specific devices fall? A. FDA Class I medical devices. B. FDA Class II medical devices. C. FDA Class III medical devices. D. EPA regulated environmental devices. Correct answer C. Knowledge point explanation. Core rationale. The Food and Drug Administration, FDA, categorizes medical devices based on patient risk. Class 3 devices represent the highest risk category because they are typically implantable and sustain human life, requiring rigorous pre-market approval, PMA, before sale. Trap analysis. Option A is incorrect because Class 1 devices are low-risk items subject to general controls, such as basic handheld retractors or bandages, not life-sustaining implants. Option B is incorrect because Class 2 devices pose a moderate risk and usually require a 510(k) pre-market notification, including items like steam sterilizers and chemical indicators, not heart valves. Option D is incorrect because the Environmental Protection Agency, EPA, regulates environmental disinfectants and emissions, having no jurisdiction over surgical implants. Concept extension. Since Class 3 devices undergo the PMA process, manufacturers must provide extensive scientific and clinical data proving absolute safety and efficacy. Question 7. Following a tragic incident in the operating room where a defective surgical stapler contributed to a patient's death, the hospital administration immediately convenes an emergency meeting. Under the Safe Medical Devices Act, SMDA, who is legally mandated to report this suspected medical device-related death to the Food and Drug Administration, FDA? A. The device manufacturer independently. B. The healthcare facility independently. C. The device manufacturer and the healthcare facility jointly. D. The attending surgeon and the surgical circulating nurse. Correct answer C. Knowledge point explanation. Core rationale. Under current FDA regulations and the SMDA, medical device reporting is a strict shared responsibility. When a death is suspected to be caused by a medical device, both the user facility, hospital, and the device manufacturer are legally required to submit a formal report. Trap analysis. Option A is incorrect because relying solely on the manufacturer leaves a critical gap in immediate clinical reporting. The hospital must also report. Option B is incorrect because the hospital cannot bear the sole burden. The manufacturer must investigate and report engineering failures to the FDA. Option D is incorrect because the legal reporting mandate falls on the healthcare facility as a corporate entity, usually managed by risk management, not exclusively on the individual clinical staff members in the room. Concept extension. If a medical device causes a serious injury but not death, the healthcare facility is required to report the incident directly to the manufacturer, or to the FDA if the manufacturer is unknown. Question 8. A newly hired Sterile Processing Department, SPD, manager is strictly enforcing compliance with ANSI/AAMI ST 79 standards and Food and Drug Administration, FDA, regulations during routine audits. When explaining the primary purpose of these rigorous guidelines to the staff, the manager emphasizes that standards and regulations fundamentally set the department's baseline levels of A. Instrument turnaround efficiency and processing speed. B. Quality and safety for both patients and workers. C. Departmental staffing ratios and annual budget allocation. D. Maximum inventory limits for reusable instrumentation. Correct answer B. Knowledge point explanation. Core rationale. The ultimate and primary goal of all regulatory bodies and professional standards is to ensure that medical processing procedures produce a high-quality, reliable outcome that safeguards patient health while also maintaining occupational safety for the healthcare worker. Trap analysis. Option A is incorrect because while standardized workflows often improve efficiency, speed is considered a secondary byproduct. Rushing through procedures compromises the primary goal of safety. Option C is incorrect because standards dictate technical processing parameters, like sterilization temperatures, not administrative human resource ratios or financial budgets. Option D is incorrect because inventory levels are determined by hospital case volume and administrative planning, not dictated by federal safety regulations. Concept extension. In a liability lawsuit, a facility's failure to adhere to recognized quality and safety standards can be used to establish legal negligence. Question 9. An SPD supervisor discovers a severe, recurrent malfunction in a specific batch of automated endoscope reprocessors, AERs, where the high-level disinfectant fails to reach the required 130 degrees Fahrenheit. To ensure this critical safety information is escalated nationally, the supervisor initiates a detailed report through the MedWatch program. Which federal agency regulates this reporting system? A. Environmental Protection Agency, EPA. B. Centers for Disease Control and Prevention, CDC. C. Occupational Safety and Health Administration, OSHA. D. Food and Drug Administration, FDA. Correct answer D. Knowledge point explanation. Core rationale. The FDA strictly regulates the MedWatch program, which serves as the primary national clearinghouse for adverse event reporting and safety information related to medical devices, drugs, and other FDA-regulated products. Trap analysis. Option A is incorrect because the EPA manages environmental hazard reporting, like chemical spills, not clinical medical device malfunctions. Option B is incorrect because the CDC tracks epidemiological data and infectious disease outbreaks, rather than serving as the regulatory body for commercial equipment failures. Option C is incorrect because OSHA manages reports concerning workplace injuries and occupational hazards affecting the employee, not the functional failure of the medical equipment itself. Concept extension. Healthcare professionals are highly encouraged to voluntarily submit MedWatch reports even for near misses to help the FDA identify potential manufacturing defects early. Question 10. A central sterile processing hub is tasked with dispatching a 500-pound truckload of supplies across a 15-mile public route. The manifest includes both clean surgical trays and sealed biohazard bins containing soiled instruments returning from a satellite clinic. Which federal agency enforces the strict statutes relating to the transportation of these clean and soiled instruments? A. U.S. Department of Transportation, DOT. B. Environmental Protection Agency, EPA. C. Occupational Safety and Health Administration, OSHA. D. Food and Drug Administration, FDA. Correct answer A. Knowledge point explanation. Core rationale. The DOT is the federal regulatory agency responsible for overseeing the safe transit of hazardous materials on public roadways. Because soiled instruments are classified as biohazardous, their transport between facilities falls directly under rigid DOT regulations regarding proper rigid containment and warning labeling. Trap analysis. Option B is incorrect because the EPA regulates the final environmental disposal of biohazardous waste, not the vehicular logistics of moving it between buildings. Option C is incorrect because OSHA protects the worker handling the instruments strictly within the confines of the healthcare facility, losing jurisdiction once the truck enters the public highway. Option D is incorrect because the FDA regulates the clinical manufacturing of the instruments, not the interstate or intrastate trucking regulations for soiled biohazards. Concept extension. State and local laws regarding the vehicular transport of medical waste are nearly always modeled directly on these federal DOT standards to ensure nationwide consistency.